Stepping over here, since David is out on set, I'm coming on to do my next segment. And
Arthroscopy.
Arthroscopy. So I have Dr. Ryan Urchek here, and he is talking about joint pain. And if you're a candidate for joint pain, this is someone who can absolutely help you out from the Crystal Clinic. I'm glad you're the doctor and have to go through the words like that. I'm telling you. It's good to have you here.
That's the first year of medical school, actually, just learning the jargon. So I'm getting
the words,
there.
Right? So what is arthroscopy?
So arthroscopy is minimally invasive surgery where we use little incisions, small equipment where we can diagnose, visualize, and treat common orthopedic problems within joints themselves. We use a small little camera, a fiber optic light, and water simple enough to distend the joint so we can visualize what we need to treat.
So then, now, how do you know that you are a good candidate for this, or that this is something you should be looking into because of the pain that you have?
Sure. The first thing is joint pain, whether it's in the knee or shoulder more commonly, usually patients are good candidates for it. It's more the issue that they're having. We're getting really good about the anatomy and what we're seeing as far as with the scope itself. It's more about the equipment. And surgeons and companies are working together and coming along with new instrumentation so we can use these minimally invasive techniques. Certainly healthy patients are good candidates, but even patients with issues such as diabetes are good candidates because we're using small little incisions, so the risk of infection, the risk of wound complications are less than the traditional open procedures.
Now, when it comes to a procedure like that, I'm sure people are wondering, well, how long does it take? And then maybe what's the downtime when it comes to that?
It's typically, the downtime is less. So I like to divide procedures up into a cleanup procedure or a reconstruction depending on what the issue is. If it's a cleanup procedure in the shoulder where we're going in and debriding cartilage or bone spurs, really we have you in the sling for the rest of the day, but the next day we want you out of the sling and working on motion. Same thing with the knee if we're debriding any meniscus or cartilage. Now if we're doing a bigger reconstruction, certainly there's a rehab that goes with it, and that's the most important part. Actually, patients, I tell them, you know, you have 6 to 9 months with their reconstruction and their rehab, and that's the most important part. But certainly with the techniques itself, it offers up and moving the next day, and we want patients getting on a cycle bike and get going.
So you, as a doctor, I mean, you can only take it so far. It's really up to the patient then for that rehab process.
Right.
I mean, is there a chance if they're not doing any of that they wind up back in the same position they were in before?
Absolutely. I usually have this talk with patients afterwards. I say, I like to think that I had the hardest part of surgery, but really my 30 minutes to 2 hours is actually the easy part. The patient's got to live with this for the next 6 to 9 months or 3 to 4 months, depending on the condition. And that's where they're living with it day in and day out, doing their rehab, doing their exercises. And that's really where they get out what they put in. So that's the hard part, certainly.
And again, if someone is starting to feel pain, this is something that I feel like you should really look into right away, because then it could get to a point where your services really don't work on them anymore.
Absolutely, that's a great point. We get concerned about that with certain things in the shoulder, like rotator cuff tears. There's things that we can do in the acute setting, and if you fail conservative treatment, obviously, it's not always about surgery. We like rehab and anti-inflammatories and things like that. But we certainly can treat conditions, get patients back up on their feet or using their arms, going back to work quicker, rather than putting this off for years and years and thinking that they're not a good surgical candidate.
So how does it work? Then they come in for basically an initial consult with you?
Absolutely. I'm in the Greene and Wadsworth locations now, but we have physicians all over the Northeast Ohio area, and they come in, we see them. Typically there's some sort of imaging ranging from anywhere to an X-ray to MRI. Then we sit down with the patients, and I spend a lot of time with patients telling them that you know, it's elective surgery most of the time, so it depends on how bad their issue is and what their options are, and I'm happy to do whatever they want to do.
What would you say would be the =1 mistake you see with patients who come in?
Typically thinking that, you know, they don't have an issue as far as where surgery can help them. Within the shoulder, they think it's either too far gone or they haven't tried, you know, physical therapy and anti-inflammatories, and there's nothing that we can do for them. And we look at them, we examine them, we talk what their options are, and usually surgery has very good outcomes, especially with this arthroscopic technique, and patients get back on their feet and wish they would have done it sooner.
Dr. Urchek here again with the Crystal Clinic, and your locations, where are you again?
Greene and Wadsworth.
Keep that in mind, and if you're in pain, he's the man to help you out.
You got
I'm going to let
Thank
him
you.
do all of the hard words together. Thank you so much for coming in.
Thank you.
It's really simple. I'm not quite sure why I struggled with it.